And welcome back to another episode of Disciplined Stoners. I'm your host, Ellevan.
My name is Winnie, and we are the gateway drug to mindfulness.
And today...
Welcome to Disciplined Stoners, the gateway drug to mindfulness. Look deeper.
To think that we started this podcast to fight a stigma.
Look deeper. Feel more. Tune in.
So much love. The gateway drug to mindfulness.
We're here to learn. We're here to grow. Oh my goodness, our next very impressive guest has expertise in a few areas. Randomly, we'll find out, one being speed track, short stop skating.
Most importantly, this individual has had his hands in my mouth more than anyone I know.
And he's an incredible dentist also. And that's why we're having him on the show. Please get your joints up, put your hands together for Dr. Jordan Beyea.
Thank you, guys. Really excited to be here.
Thanks,
I've
bro.
definitely had my hands in Ev's mouth. This guy's tough. Did fillings without a needle. Wouldn't do the needle.
Yeah.
But yeah, tough guy.
It was really a struggle to get him to come see you, and I'm so grateful for you because we met at the yoga studio that I work at, and when I found out you were a dentist, I was like, oh. This is someone that you might actually fuck with,
This guy's a vibe.
right?
I appreciate you.
Yeah.
I'm so scared of the dentist. It's like tacks and teeth. Anything, I get anxiety, but it's like, yeah, man. You blessed me.
Yeah.
Thank you.
They're done now, and
But-
you're good, right?
Yeah, I'm good now.
Yeah,
I
perfect,
feel good.
perfect.
And so that was wild. Okay, so we can start a couple places. We were just chatting. We're so grateful to have you on. I feel like as representing the smokers community.
Short track speed skating.
That's
Short
it. You
Fuck,
got
I
it.
had
You
to
got
get
it.
it.
You got it. You got it.
I want to get
it.
into this, where you come from. You're from the East Coast. You went to school in Arizona, but we had to. It's so nice to have someone colorful like yourself representing dentistry or oral care because this is important and it's not talked about a lot, especially in the smoker community. Or there's some shame involved or something, or inevitable staining, and it's we can drop some gems and have a convo. So I appreciate you being here.
Yeah,
Thank you.
100%. No, I mean, you're definitely right that, I see it with patients, obviously, I look in mouths and I can smell, I know.
Yeah.
But I smoke weed myself and, it's very cool to me. But, it's there's nothing to be ashamed of or nothing to hide. It's just really from a safety aspect, it's just important, that I know, if we're gonna do some laughing gas, kind of want to know where your lungs are at going into it, so that's something to know, or just some people it really affects their tolerance for anesthetic, so some people they might need a lot more, other people maybe it's just a little bit. If I know somebody smokes, I'll encourage them to do it for the appointment because, if it's good for you, it relaxes you, then why not?
That's all I did,
Yeah.
Which was funny because even during our procedure, you were you were drilling some cavity away, and you're you're making me sweat because I was going.
I know. Well, I thought it was the fact that you
That's
didn't
high
get
as
any
shit.
freezing meant that you needed to do your work
In
with a person who is experiencing intensity. Actually,
Thank you.
and there might have been flinching involved, or
we went in stages.
Yeah.
This guy is a
Little
military.
bit.
He's a Navy SEAL.
And that's
He's
also
"All right." And I'm oh, okay, give me a break, give me.
Yeah.
Okay, go ahead.
Okay, is that something? Because we knew each other, and so you guys had met, I think, previous to or seen around the studio.
Yeah, a couple classes. Yeah. for
Yeah,
sure,
yeah. So, is that something that you he obviously was very upfront with you, saying that he didn't want these needles. It's not something that he really fucks with.
Yeah.
Is that something that you would discourage other people?
Generally, I try to talk people out of it.
Yeah.
I have a pretty good technique of making it so you don't feel the needle. We actually at that office we have this automated freezing, so you control it with a foot pedal, and it just drips the anesthetic in, because really it's not the needle that
It's
actually
the
hurts.
feeling.
We rub the topical on the gums. You're not really going to actually feel the needle. It's the liquid that's going in, expanding the tissues. Yeah. So if you just that's the sting though. That's the sting.
Yeah.
So if you just drop it in, like I'll tell young dentists that I work with, like if you just keep your finger just on the plunger, you don't even push it. That's the key to kind of giving like a painless injection. But some people are just needle phobic. And you can't do anything about it, and like Ev's one of them, and like we do the little bit at a time trick, and it's tough to see the other end of it, like because I know like what he's going through.
Totally.
But hey, let's teach their own, and yeah.
And can you just get a napkin? Okay, so it's important for smokers to disclose that information to you, even though you know. But like that would probably create a more open dialogue around it.
Yeah, for the clinical safety part of it, 100%. Like it's just good to know. Also like for.
This is just for you if you want it.
Okay, perfect. Thanks. Yeah. Like if depending on what's going on, if there's surgery going on, like what drugs are going to be prescribed afterwards. Like because some people like how cannabis might affect them. Is there like that's their anesthetic or their analgesia afterwards. Instead of taking Tylenol 3.
Right.
Maybe it just works for you to take a chocolate.
Yeah.
Right.
Yeah.
So rather not give those drugs if I don't have to. So it's good
Sick.
to know. Like
That's awesome to hear.
So when you were at school in Arizona,
yeah.
did you guys in dentistry school, is this what it's called?
Yeah, dental school. Yeah.
Dental school. Do you guys cover like a history portion?
Like the history of dentistry?
Kind of.
I actually took a class in undergrad, history of medicine, and there was that like a little bit of that in it because it used to be like the dentists were barbers, right? Did
they give cocaine? Is this a thing?
That was a thing. I think at some point in the
I feel like I should have submitted this question to you before.
That's
I
fine. No.
But like,
like,
I'm just like that just came to my mind right now. It's like, is that a thing?
All the anesthetics are like carbocaine, lidocaine, articaine. So they're all canes.
Oh yeah, Novocaine.
Yeah. So and it's funny because we add epinephrine into the anesthetics because it constricts the blood vessels and it keeps the anesthetic in the area. It makes it work longer. Okay, so
epinephrine. Is that adrenaline?
Adrenaline. Yeah. So that's in pretty much all of the anesthetic. The thing is, cocaine actually has like epinephrine restrictive qualities in it, right? That's how people get friggin' nosebleeds and whatnot,
You
right?
get the numb phase.
So like it would work very well as an anesthetic. It's just that it like we give a bunch of needles a day. I think we go broke if we were giving cocaine.
Yeah.
Exactly. What is this, a Miami nightclub?
And now before your procedure, take a sniff.
Amazing.
Would you knowing, like when you know or you have an open dialogue with your patients that they do use cannabis, does that change your the way that you treat them? Not treat them like, hey, nice guy, cool guy, like as a doctor, like how your treatment plan for them or what they're looking at in terms of what their oral care needs. Can you imagine?
I mean, I guess it depends on what I'm seeing in their mouth. Like things with any kind of smokers, there's just common things that you see, like dry mouth is a big one. Easy cure to dry mouth is a thing called xylitol. And xylitol, you can find it in gum, you can get it in toothpaste. Xylitol is really good for dry mouth. Because essentially the harm with dry mouth is that saliva naturally protects your teeth against cavities. So when you have dry mouth, often people when they're older, they're on medications that cause severe dry mouth. All of a sudden they're 75 years old, they've never had a cavity in their life, and they have cavities everywhere. And it's just because they don't have that salivary flow that's protecting the teeth anymore. So if you are a heavy smoker, and like some people smoke a lot and have like too much saliva, I'm trying to isolate their tooth to do a filling, and there's saliva everywhere, and it's like no problem. But everyone's different. So your mouth, and you can kind of tell obviously like there's the pasties, and then that's that's a thing, right? So if you're pasty all day long, all the time, then like chewing some xylitol gum. Get it on Amazon. It's cheap. Just get it, and there you go.
That was huge value to us. Woo. I'm going to get it immediately.
Yeah. because that's a major thing. It's always like we're trying to stay hydrated. That is one thing about stoners. We're like always like, I need some water.
Yeah,
Like I've never
right,
had
yeah.
such a demographic of friends consistently be like, does everyone have water?
Yeah. Which is great. I mean, you need
Yeah.
water, right? Stay hydrated. That's
Yeah.
awesome, right? You know.
Does smoking cigarettes do the same thing to oral health that smoking weed does?
Only in, so there's been like some like suggestion recently that there's maybe some association of oral cancer with weed smoking as well. Oral cancer, mind you, is like 2 to 3% of all cancers. When you get it, it's bad. It's often late, you know, we try to screen for it, but it's something that like we can always get better at doing. So, you know, like the risk is there, but it's really low. However, compared to cigarettes in general, cigarettes are just terrible. Essentially what they do to your circulation is the problem.
Of your blood?
Yeah,
In your
blood.
blood?
So that's something that marijuana is not going to do. Is not going to restrict, you know, the local circulation, you know, in your mouth. So like, you know, when I have a smoker that has like gum disease, we'll take a tooth out and like it'll be barely bleeding. And that's the issue, you know. So like diabetes, smoking, like these things that like essentially like just like deprave, you know, your body of the microcirculation around your teeth and your gums. Then now like there's a lot of things that are in everybody's blood that helps fight bacteria. So when you don't have these things and your blood's not getting to the area, now bacteria is just going to grow. It's going to eat your gums, destroy your bone, and you know lead to tooth loss ultimately. So
We have the natural capabilities of our body if we just keep it.
exactly. So you just it's all about doing things to promote those natural like things that your body's there like the body's able to do on its own. You know, so
So it protects itself.
exactly. Yeah.
It's beautiful.
So yeah, one of the things you asked about was oil pulling.
Yeah.
So that's like a great thing to do, you know.
Yeah?
Like it's, you know, Ayurvedic medicine. It's been there for a long time. It's awesome to do.
Fuck yeah.
We love that.
Any
coconut organic oil.
I mean, coconut oil works like everywhere, right? It's awesome.
It does. The whole body.
Yeah.
Head to asshole.
Exactly.
The whole,
everywhere in
it's
between.
great.
Yeah, 100%.
Yeah.
Okay, so
Miracle.
you
Miracle.
seem very open to like natural things. As much as I know you, you've been very open to natural ways of living. And obviously there are reasons to have like more, I guess, Western medicine involved. Do you get any pushback from other dentists on like would saying oil pulling is awesome to another dentist be like, oh, is that a no-no?
You're not maybe going to get pushback on that. Where you start getting pushback is because this is how we're trained in dental school. All dental schools is rooted around fluoride.
Ooh.
Yeah, okay, because
The
basically
big
what she
fluoride
said, she said the
controversy.
very polite version of, you seem like a good woke indoctrinated. Because in order to participate in Western medicine, you have to be indoctrinated to some degree, and there's standards that, hey, I'm glad we adhere to. Cleanliness, thank you, right on. Sign all the whatever you need to do. Tell them whatever.
Yeah.
Thank you for doing the work. But like, you know, so there's a good structure there, but sometimes it seemed to have lost its heart like anything.
Right.
It's square and it's
Yeah.
like procedurally, mechanically correct and documented to like inform, but like you seem to also be moving with the heart.
Yeah.
Or like open to natural medicine or historical methods as well, rather than just completely blindly going into like word is law.
Exactly.
Or
yeah.
science.
Science,
Well, yeah. So like, the first part of dental school, like we take it with med students, and we all learn about the body, everything, and like you know, you learn early on then that you know fluoride is like a neurotoxic chemical. So
And it's
you
in
know,
everything.
And it's in everything. So like the one thing you'll find if you go anywhere around the world on every shelf in any pharmacy is the same toothpaste is everywhere. And like this is big massive business for you know companies that you know are billion-dollar companies or worldwide. They're not going anywhere, right? But in general, like these mouthwash is essentially what it's doing is it's going to make you feel like you have good breath, but it is usually alcohol based. It's destroying a lot of the good bacteria. There's a lot of good bacteria in your mouth. There's 700 species of bacteria in your mouth. Some are good, some are bad. And essentially, just like taking an antibiotic where it wipes out all the good flora in your gut, chronic mouthwash use is going to wipe out the good bacteria. When you stop taking it, the bad bacteria is able to take over, and you get dependent on it. You have bad breath. So like,
It's
really,
chemo of the gums.
Yeah. So like the best mouthwash, honestly, is just salt and water. Sea salt, water. Boom.
I've just been
Awesome.
doing that to
Yeah.
get my
Alkaline.
yeah.
Yeah,
Oh.
absolutely.
So you just mouthwash or salt and water.
Yeah.
Cold water, hot water, doesn't matter.
Yeah. And
Okay,
like, and
so-
you can brush your teeth. Honestly, just brush your teeth with coconut oil, little baking soda. Take a little pill of activated charcoal. Put that in there. That's going to help whiten them. The baking soda, it's going to bring the pH up, because often what happens, people don't realize. I see people that, you know, they have a very acidic diet, and they're like, oh, hey, what's wrong? Like, my teeth are yellow. I brush my teeth all the time. Right now we're having coffee. Okay, the acidity in coffee is going to stay in your mouth for 30 minutes. Okay, so if you go brush your teeth right now, the enamel is slowly dissolved, and you're kind of brushing off that enamel. So it's not that your teeth are getting yellower because the enamel is getting thinner, and on the inside of the enamel is the dentin, which is yellow in everybody. So that's kind of something to be aware of, you know, is yeah.
That's a clip. That's a
Dude,
motherfucking
you just
clip.
blessed us. That's incredible. Are teeth bones?
Essentially they're bones. So their teeth are made of, it's called hydroxyapatite. So it's a mineral that's also in bones.
Sounds like an addiction.
Yeah.
He died from
Yeah.
hydroxyapatite. Sorry.
But there is a toothpaste. So actually, apparently, in outer space, since the 1970s, the astronauts have been brushing with hydroxyapatite toothpaste, so they don't get, you know, a cavity when they're as far away from a dentist as you could possibly.
When
be.
you can't just
Oh,
drive you
wow.
out.
Yeah.
Wow.
So I actually wrote it down.
Are you kidding me?
I know.
So can we
So
get
there-
this? Can a
yeah.
human
So there's a company called Himalaya Botanique. I looked it up on Amazon before I got here, and
You're the best.
it's a toothpaste, hydroxyapatite toothpaste, no fluoride, and it has xylitol in the toothpaste.
Let's go.
Yeah.
I will get some immediately.
So that's like, you know, if you can afford a $15 like tube of toothpaste, that's the tube to get.
Can you
Yeah.
afford
Fuck
to
yeah.
get a
Yeah.
cavity while we're this far in
The
space?
thing is, like
No.
any second in dental chair is going to cost you more than $15, so it's definitely worth it.
Oh,
But
we
it's a
can
good
turn the air
investment.
conditioning back on
Oh,
now that
good.
the coffee's off.
But it's a good investment either way.
Wow, you just gave us so much wealth. Thank you. I know there was a few things that I've lost it. I got high before this, and that was so cool. Thank you for that. But
No
what
problem.
I wanted to ask you, what would be considered standard oral care, like daily hygiene? Like what should we be striving for?
Okay. Yeah.
Or even doing at a minimal, I guess.
Yeah, I mean, well, I'll give you an ideal routine.
Yeah.
You know, if you have the time to do the oil pulling in the morning, that's great.
5 minutes? 2 minutes?
10.
10
like,
minutes?
Yeah, I mean, like 5 is plenty, but if you can go longer, you know, you can. Like, you know, I find like after 5 minutes, like, I get all the saliva going.
Yeah,
It's just
it's-
like I have like a mouthful of oil. I just have to, you know, get rid of it.
Yeah.
Something you can do if you have, you know, like you're just prone to, you know, periodontal disease. For some people it's genetic, you know, they have bleeding gums, is you can, and it doesn't taste as good, but a little drop of clove oil in the coconut oil. The bacteria do not like whatever's in clove oil. It's like when you take the oregano oil when you're sick and,
Yes.
you know, it tastes bad, but like, you know, it's working. Kind of the same thing.
Oh my
So a little
God.
clove oil, that's another thing that just get that, you know,
I am
essential
gonna
oil drop,
level
put
up
that,
my
put that in there.
oral hygiene.
Yeah.
And then like that smells kind of good too.
Yeah.
Yeah, it does.
Like
yeah,
a
exactly.
natural breath freshener.
Yeah.
What do you think about Excel mints and stuff? And
No,
mints?
no, he's not done the
Oh yeah,
standard.
yeah. So
I'm sorry.
then after that,
Do you like parrots?
another thing you can do, and also it's a morning thing because usually this accumulates at night, is tongue scraping.
Yo.
Yeah.
Metal, plastic, doesn't
So
matter.
the best one is called Dr. Tongues, but it's T-U-N-G. Dr. Tongues. It's like a metal. It's like a U.
Yes.
And you just do that in the morning. Get like, 'cause like at night, you know, a lot of people mouth breathe.
Yep.
And like also, you know, if you have dry mouth, it's just gonna, like, stuff is just gonna build up on your tongue when you're sleeping. So it's not as important to really do it at night. You can do it at night too, but usually it's gonna be more helpful in the morning. And if you do it for a week, you'll find your tongue goes from like that little white coating, just disappears. Now your bad breath is going away, and like the need for using again like mouthwash is just like not really going to be there for you. So
Nice. So you're like basically not for mouthwash.
no.
No. Okay. Thank
Oh
you.
yeah,
I
that's
mean, listen, there's some like antimicrobial mouthwashes that like after I do like an implant surgery, you know, like I'm
Right.
you know, I'd rather not prescribe antibiotics and rather not give these things. Like,
Right.
But like things like, you know, you just paid a lot of money to do this surgery.
Don't
and
have
like,
it.
And like if we can do anything to make sure it doesn't fail, like we're gonna do it for like 1 week, and like, you know, that's
It's like
good.
when you
That's-
get new shoes and you spray that coater on.
yeah, exactly. It's like, listen, we're gonna protect this for now. Like after the week, now it's up to you to keep it. But like
Yeah.
we're gonna do everything we can. While you got an open wound in your mouth to like keep all the bacteria out. Because you know I don't know what people do when they get home, right? When they leave. So you know, like I'm gonna give them everything there. And you know, maybe someday we'll say, hey, listen, you know what? Just go home, go heavy on the clove oil, and you know, use that as your mouthwash. That's the thing where, like, you know, in the dental community, it's like, it's just like the medical community. It's that, like, you know, we get held up because you want to have that, like, 10-year meta-analysis
Right.
study to say, hey, this is, like, how effective it is and the success rate. And then, you know, because if you don't do that and you have the wrong patient on the other end, they could be like, oh, well, hey, you know, he didn't prescribe me an antibiotic, and then you get a board complaint, lawsuit, and blah, 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 blah.
yeah,
And like, you know,
for
so
sure. There's a
it's
lot of
kinda-
like
The bureaucracy.
the
exactly.
risk.
Yeah, yeah.
or
in
at
everything.
least the perceived risk too.
Yeah.
It makes sense.
But for most people, what's good for them, like day-to-day basis, yeah, like, you know, little coconut oil in the morning, tongue scraping, like a toothpaste that, like, you know, baking soda, charcoal is going to whiten your teeth. Hydroxyapatite is what the tooth is actually made out of. So, you know, once the enamel is lost, it's like it is kind of completely lost. However, along the way, it demineralizes. So that's where you get a chance to, like, you know, like if you heard on it, like from your dentist before, oh, like we have a couple cavities that like we're watching. It's because the cavity is still in the enamel and it can be remineralized. So but the thing is, that's what
So you can brush it away.
That's what fluoride does. Because fluoride is a part of hydroxyapatite, the mineral that enamel is made of.
Oh.
But you can just use the mineral itself instead of the fluoride and not worry about any like systemic.
Whoa. How do you get this mineral?
and
So you're born with it, and after that, that's it. So, yeah.
fuck. Why is there fluoride in everything?
Well, there's fluoride in everything because like tooth decay is the most common chronic disease in the world. It's like 90% incidence, and like if you like scour the world, like 90% of people have tooth decay. Okay,
Yeah.
so fluoride in the water was, you know,
For-
government's answer to prevent widespread cavities, because essentially, you know, like you know, in if the government's subsidizing dental programs, you know, like you have tooth decay everywhere,
Yeah.
and it's like, you know, it's too much for us to do. And like, you know, like as a dentist, like I want to be doing other things than like, you know, drilling out cavities and filling teeth. Like, you know, it's like, it's good, people need to do it, but like, you know, if someday dentistry looks like we're not doing that and we're like, you know, helping people that are grinding their teeth away, or like, you know, moving people's teeth so that it opens their airway up to give them a better quality of life, or, you know, better smile, then like that's where, like, you know, there's like always like a place for the profession to do. But like, just, you know, cavities are caused by us, you know, like there's a bacteria that eats the sugar and it makes acid and it dissolves the tooth, and we usually all get that bacteria pretty quickly, you know. We're not born with it, but the second that, you know, you eat food from your
Yeah.
parents' plate as a kid, you get it. And you know, we all have it, and it feeds on carbohydrates, sugars, you know, especially like crappy sugars that's in processed foods.
Yeah.
You know, like it's like, you know, if you're eating watermelon and cantaloupe all the time, like you're not going to have like a mouthful of cavities.
Yeah.
I haven't seen it.
Yo.
You know, like, I'm not saying it's like for
It's
sure.
those
like, don't take my word.
Butterfingers.
Yeah.
It's those,
Yeah.
those
Exactly.
naughty ass,
Yeah.
cheap, fucking refined, extra white sugars that you got coming out those chocolate bars and shit. It's not a fucking delicious mango.
Okay,
Yeah.
so we have our ideal day. We start with oil pulling, not
Yeah.
a brush. You
Yeah.
start with the pulling.
Yeah.
After that, you're gonna scrape your tongue a
Yeah,
couple
just
times.
wait about like 30 minutes for all that to kind of get out of your system before, like, then brush your teeth before you go out the door. You know, just like kind of wait. You know, if you had coffee, whatever, like I said, just like let that acidity get out of there. If you're in a rush, like maybe like a little baking soda rinse, because the baking soda is gonna ramp that pH up, and your enamel's not gonna be soft anymore. So then brush your teeth, get out the door. when you come back home at night, just get the floss picks in there, get all the crap out of your teeth, because that's what's going to lead to the bad breath too. You know, just get that out of your teeth. You know, if you want to give them another good brush, like that'd be great too. You know, like, you know, get everything out of your teeth before you go to bed, and like that's really it. You know.
So brush twice a day.
You brush twice a day, floss once. Yeah.
Yeah, I don't be flossing every day.
Just the key I find is like what I do is I get those the picks.
The picks. That's what I don't have right now.
I put them in my car. I put them in places where I am, and like, you know, like when I'm not flossing, it's because like I'm busy and I've run out of the picks and I haven't restocked like my areas where I have the picks.
That's
and
it.
like I'll admittedly go like, you know,
I'm going after this.
Go days without flossing because I don't got the picks in the right spot, and like, you know, I just haven't got to the Amazon.
Where
to
are the
order,
picks?
And
You
I go on my
inspired
phone,
me.
I get distracted and I don't get the picks for a while. You know?
That happens.
Yeah.
You're
right?
human too.
Yeah.
That's nice. That's
exactly.
nice to hear that you sometimes forget
Yeah,
things.
absolutely.
Okay, that's cool. That's like, I feel like that's an accessible. I mean, you know,
So-
coconut oil can be expensive, so I hear that for
But
sure.
on the
But
toothbrush,
salt,
you said unique thing. You're right. The mouthwash for salt and water. is
Yeah.
great.
Yeah.
But on the just to clarify, instead of toothpaste, baking soda, charcoal, and hydroapatite?
No,
you
just
can't get any
coconut oil, baking soda, and activated charcoal. If you want to make a homemade one, or just get this Himalaya Botanique one.
Okay.
Yeah, like, you know, that it's a great toothpaste. That would be the one that I'd recommend.
That's the
Then
one.
there's like some other brands that are like it too. They're all kind of the same.
Bro, we got to get you an affiliate code with these guys.
Yeah.
So is the fluoride mouth guard situation still alive and well?
Again, like for like those old patients I was telling you about that have like really bad dry mouth, no saliva at
Right.
all. Yeah, like it's standard to give them like a high fluoride toothpaste, put it in trays, and they wear that. But you know, honestly, like I'm kind of new to finding out about this hydroxyapatite toothpaste, and that like it's even a thing myself. You know, it's not something that like we're really like taught, or that I would say generally like a lot of dentists even advocate for or know about. So yeah, I wonder if like those patients, if instead of the prevalent 5,000 that they usually have, which is just like a bunch of fluoride, inevitably you're going to swallow some of that. And that's the thing, is that when you swallow it, you don't know where it's going in your body, and like depending on how your health is, you don't know how it's going to affect you. So yeah, I wonder if that toothpaste, just as a substitute, it'd be, you know, work for them. I'm sure it would. But, yeah.
Do you think fluoride crystallizes the third eye? Have you heard this conspiracy
No,
theory?
but go down the rabbit hole. I'll come with you.
I don't know. I don't know if it,
The pineal gland.
I don't think it's as much probably because of the fluoride, but I will say when I first started meditating, I did feel like a crusty opening before I could access my imagination fluidly. And the nice gentlemen on YouTube videos say that that's possibly fluoride, and I'm like, I don't know. It could just also be the fact that we don't access that.
No, if fluoride is a neurotoxic, he said that it's a neurotoxic. So
Like,
yeah,
maybe
it's
it
possible
builds
that it
up.
could
Yeah.
have an effect for
or
sure.
like how do you think it builds up in the body anywhere like that? Like,
Well, it definitely crosses the blood-brain barrier.
it does.
It does, yeah, it does.
Okay.
Yeah, so it does. So,
So it's in there. Like we have fluoride in our.
yeah,
like,
exactly.
If you live in a city, especially.
Yeah, no, I don't know how, like the science behind going about like ridding your body of fluoride.
Right.
You know, because it's in like a big thing is that it's in like, you know, like the non-stick pans, like the Teflon is essentially
Yeah.
like you know, that's why like water doesn't stick to it. It's just, you know, a carbon with a bunch of fluoride around it. So that's how like the Teflon works. But then the thing is, they're finding that those fluoride that are like the atoms that are protecting, you know, causing the non-stick, they leach out into the food, and then, you know, so there's a big, you know, like turn
Yeah.
against like, you know, that whole like those things won't exist 20 years from now, I guarantee you, right?
Yeah, that's what I
So,
feel. It's a thing of a
yeah,
past.
yeah.
Yeah. Trippy.
Okay. You have given us so
So
much
many
good
gems.
value. Thank you
Thank you,
so much.
Yeah.
This is like beyond what I could have imagined this to be. So thank you. Do you know about the Ontario government dental plan?
Yeah, like the new the plan that they've announced. It's called the CDCP, the Canadian Dental.
Assisted
Yeah,
fucking
I
something.
forget what it stands for, but
Yeah.
so far they've rolled it out to people age 70 and above,
Okay,
and
nice. So it is for
and within certain income brackets. And it's really good. It's led to us having new patients, because the big thing about these government programs is that like before there's what are they called? Like an ODSP patient. There's Serta is another one. The problem with them is that, like, you know, if a regular fee for like taking a tooth out is $200, they'll pay us like $30.
Nice.
And you know, like
so they're not getting a significant.
So yeah, so for us, it's like, you know, like we'll do it, you know, but it's like almost like you could really just do it for free.
Yeah,
you know,
yeah.
At this point,
You're
it's
like,
like
I would feel better if this was
you
pro
like pay to
bono.
keep the lights on, like, you know, like usually dental overhead is running at like, you know, between 40 and 60%. So like a lot of the money just, you know, dissipates pretty quickly.
Yeah.
But with this government program, you know, the politicians didn't say this on TV, but how it's becoming widely accepted by the dentists in Ontario, at least, is that you know, they're depending on how you qualify. Some people will be 100% covered, and the government will pay the full check for them.
Nice.
Some people are 70%. So like, you know, you pay your 30%, but like this is coverage that you didn't get before.
Yeah.
And like, you know, you kind of have to pay the 30%, you know, because we can't just be like, hey, listen, we'll just take the 70 and not charge you the 30. It's like, you know, kind of like creates a little accountability.
For sure.
And, you know, like, because another problem with like the patients often that we see in these programs are that, you know, because there is no real like monetary obligation for them, is that they just don't show up for their appointments. You know,
And they're probably keep staying with bad habits outside of their appointments.
Exactly.
I
Yeah.
mean, it's a little unfair to say because some of this is
Yeah.
low income, and you know.
Yeah, but even if it's $30 that pisses you off that you have to pay it, that maybe causes you, you know, gets you to brush your teeth a little more. Then,
I
like,
think
you
paying
know,
for things. I'm all about paying for things for
Yeah.
accountability.
just a little bit, like it doesn't, you know, just so if it's just a significant enough, where it kind of like you feel it, then like it'll change your behavior, and then like, you know,
because
Even
they
if it
feel
impacts
they're
you.
still investing in themselves.
Exactly.
It literally changes the behavior. It's a good thing. It's
It's
a good
part of
thing for
prosperity.
everybody.
Yeah.
For sure.
Yeah, and you
Okay,
know,
that's awesome. I
yeah.
wasn't sure if it would like take work away from you.
Well, yeah, I mean, everyone was pretty, like, you know, nervous about it before it got rolled out, because they didn't really tell, like, our dental association.
They
didn't tell you anything.
They didn't tell us, like, we were hearing about it on TV just like everybody else, and we're like,
Oh my
hey,
God.
I guess it's starting, you know, in
That's
2 weeks.
insane
It's
because
crazy.
they should have consulted you guys,
Yeah,
right?
so like our association was just like, don't accept it. But then like a couple weeks later, they're like, oh, we're just like, because they were making the dentists like sign up for it, and then so like our association was like, listen, don't sign up for it because we don't know, like, you know, what might be behind the curtains and whatnot. And then it was like, I saw it on, again, like breakfast television. It was they were like, hey, listen, starting in July, we're not going to make the dentist sign up for it. So every dentist is signed up, and you can just choose not to take it if you don't want to take it.
Oh, nice.
So
Because
do
no
they
one
have
was
to?
signing
Would
up.
they have to tell you prior to the appointment that they're under?
Yeah, so they have a card, they come in
Gotcha.
with it, and then that's basically how it works. So yeah, like honestly, so far for a government program, smooth sailing.
Wow.
Yeah.
That's so great to hear.
Yeah.
I think a
Rob
lot
will
of
most
people.
likely take advantage of this.
Yeah. And
I don't know where all the money's coming from, but
Yo, exactly.
yeah.
What are they rinsing?
something somewhere.
fuck,
Yeah.
bro.
Good. Fuck it. Give folks some.
I
some
love
relief.
that you just said that.
Yeah.
Do you know if it's going to be accessible for people in their 30s?
Yeah. Apparently it's you know, they're kind of going down like the ladder,
Okay,
but
cool.
like apparently it's
Let's
and-
fix all these old fuckers' teeth first.
Yeah, they got a lot of problems, man.
Totally.
Yeah, they do.
And it affects the health heart, right?
Yeah,
A lot.
And the thing about them, like, they're alive for longer than they planned on. You know, like they had insurance their whole life, and like the thing is, and now like 15 years into retirement, like, you know, our best work is not going to last forever. So like, you know, it's going to come a time where, like, you know, your tooth breaks, and sometimes like if you had all your teeth fixed at once, now they're all breaking at once, right? And so now you don't have insurance, and like these people, like, they definitely really need it, you know. But like it'll be nice to get, like, roll it out to, you know, like, you know, everybody in some capacity.
You changed
too.
lives, bro.
Yeah, no,
You
yeah.
You literally took pain out of my face.
And so they can get anything, or is
No,
cosmetic?
it's limited, you know.
Okay.
Like it just depends. Like right now, it's only
Just
like
get some veneers,
like
just-
fillings and extractions. It's gonna be like, you know, some partial dentures and like some things that
that's good.
people need too. And like, you know, I'm not sure how the coverage is gonna work, but you know, we find out when the data
Yeah,
roll it out. Yeah.
You just
Yeah.
got to roll with it. Man,
Yeah.
that must be a bit of a shit show.
Yeah.
Okay, so there was some. Oh yeah. What We need to talk
The
about this
root canal.
controversy.
The root canal
over-
controversy.
Yeah, well, did you guys see the Netflix documentary that was like, it was like a year ago, and then they pulled it?
Really?
No.
What went on?
No, it was
No,
like,
that
it was
was-
maybe like it was a year ago around Christmas
I
time,
probably
maybe.
didn't watch it. As I said, I'm very. You are the delightful
So,
angel of dentistry. Anything I usually don't look at teeth at all.
We have to be careful here because talking about this root canal thing, a lot of the podcasts actually they get censored. Yeah.
We're already
We don't
censored.
give a
Yeah,
fuck.
all right, you're already
We
censored.
don't
Yeah.
give a fuck.
Yeah.
And we're over 18.
This is going on X.
Yeah.
Fuck you.
Listen,
Really?
I
Okay, go ahead.
I don't have. There's a lot of people coming out. There's a guy I was just listening to on the way over. His name's Dr. Dom from Germany, and he's like a biologic dentist. Okay, so it's a new thing. But one of the things that we're able to do now with dentistry is take like a 3D X-ray instead of a 2D X-ray.
Ooh.
And so what you find on a lot of these 3D X-rays, it's not that all root canals are bad. It's just that even a root canal that looks great on a 2D X-ray that's done well, you see this little pocket of, like this infection that's, it's been contained by your body. You'll see that like the bone is a lot whiter in the area and it's kind of walled off, and you're never going to probably have pain from it. But there is getting research that's showing that like it is chronic inflammation, which is a stressor on the body. So there are it triggers a cascade of chemical messengers that just cause can in different people cause different things. The body stress, that's. I'm not saying root canals cause cancer by any means. I'm not saying that. It's just that that having chronic inflammation in your body
Yeah.
is not good. That a root canal is like the only.
Can you explain what that is
What a root
exactly?
canal is?
Yeah.
So essentially, you get you have a tooth. On the outside, you have enamel. On the inside, you have a nerve. Okay, so the cavity, when it gets into the nerve is part of your bloodstream. So now the bacteria from your mouth is traveling in your blood. And so that's what they find, and it doesn't have to be through the tooth. It can be through gum disease. They find that there are certain bacteria that only exist in the mouth. But then you do an autopsy on the body, and you'll find a bacteria that's really called P. gingivalis. It's a mouth bacteria, in the heart.
Yes.
And so it's how did it get there?
Fuck.
Right?
Wow.
So
Right in through the inside
you
job.
You didn't swallow it, right? It got through the blood, right?
Yeah,
so
inside
so
job.
it's through the bloodstream. So
You gotta go. You gotta get that shit out.
So the thing, what a root canal is you go into the tooth and you get rid of the nerve that's in there, and then you seal it off at the end. So essentially, you are keeping a dead tissue in your body, but it's the thing is in reality on the other end of it, someone has a cavity that gets a toothache. It's a lot for me to say, hey, listen, we're gonna now take your tooth out. And your real only option is we replace it with a dental implant, which is, it's expensive, right? So often root canals are highly subsidized, so they get done a lot. And listen, I still do root canals, I send patients to specialists to get root canals done when it's a complicated root canal that I don't want to do. But we'll just see what happens. There's definitely some things brewing, and some research will have to be done about what because we're just learning a lot more, being able to do these 3D scans of teeth,
Cool.
take bacterial cultures, sample them, and see hey, listen, is this really a procedure that is the best for the patient?
Yeah.
Even though listen, if you're about to go on vacation and you don't want to lose your front tooth and you have a bad toothache, we're gonna do a root canal. We just maybe want to come back and revisit what's going on in that tooth,
Right.
Because inevitably this is a fast way to get you out of pain. From what I hear, toothaches are worse than pregnancy, so they're terrible, right? So, if the answer is just to do a quick root canal, that's a skill all dentists, most dentists learn how to do, and
I feel
there'll always be a place for them. It's just
Yeah.
that hey, there's maybe other options you should consider if you're a person that's really conscious about what's best, what the best options are for their mouth and the rest of their body. So
That's amazing information that I don't think a lot of people know.
yeah, we just don't give that much thought to it.
Yeah. And also, I think controversy is so wonderful because it's going to cause this growth in dentistry.
Yeah.
And if you guys thought you knew everything about the mouth, there would be nowhere to go.
yeah.
So what can we do instead then?
Well, that's the thing. Like, really, if you're not going to do root canal, you have an infection, you have to take the tooth out.
Yeah. Either way, the tooth got to come out.
Which, if it's a back tooth,
Yeah.
and hey, listen, I got a bunch of back teeth, maybe I don't care, then no big deal. If it's like a front tooth, then that might be like something more of a priority to replace it, right? So that's the thing, so.
And is that considered surgery?
Yeah, surgery. Yeah.
How many of those can you do a day?
A bunch. How many of what?
Like a procedure like that.
Like taking out a tooth.
Yeah, taking out a tooth. I mean, some days I take out a lot of teeth. Dozens, yeah.
Dozens?
Yeah.
When did you decide that this was going to be something that you pursue? Like,
that's a
how
lot.
did you make this decision?
Well, I guess like kind of two-part.
East Coast boy.
First one, I was playing hoops, grade 11, and I came down. Went up for a rebound. Other big guy came down. I had braces on at the time, thankfully. His elbow just went like right here, and my teeth just went like back, like no room for my tongue, and so it was bad. And
I don't know how to process that right now.
so it's like a weeknight, So my mom calls my dentist, and he's like, "Yo, George just got in a bad accident. Like, can you see him?" And all he knew to do in this scenario was like, "Yo, hey, I'm just gonna because I had the braces on. He just pulled the teeth back forward."
No, he did
Yeah.
not. What?
Yeah, and obviously all the teeth died, and I have 3 root canals on these teeth down here.
Oh my goodness.
But I was like, dude, that was pretty fucking badass, because I was when that happens, you don't know what's going on, right? So that was the first thing that kind of got me a little inspired to it.
Were there, when you say back, had the roots become exposed?
No, it was just the bone's really soft here and everything, so it can just kind of bend. So it just kind of bent back.
What?
Yeah. Yeah, because it was literally just my head hitting the hardwood, elbow, and then the teeth in between. So yeah, it was pretty bad.
He's not.
Yeah.
He gets overstimulated. He gets overstimulated. Okay. We're not going to talk anymore about the teeth.
So that was the story of how I got into it. But so
I'm just kidding.
Okay, so
I'm semi-kidding, but also that's incredible. I'm so glad you're here. That's fucking intense.
Yeah.
Also, when you have a kid, shit like that happens.
Yeah, so be friends with your dentist and get their number. And just if your kids are playing sports, also we can make mouth guards for them, so that doesn't happen.
Oh, nice.
Yeah.
Oh, so nice.
Right.
Okay, so this leads to a really good point, and this has been the case with touched people, meaning people I feel living their purpose or feeling fulfilled in what they're doing in their life, is that you had this craft impact your life in a drastic way at specifically a younger age.
Yep.
And it was you're I'm fucked up. This dude came in like a superhero and was just boom.
Yeah.
And you're it's so it impacted you so much.
Yeah.
And then so right then you knew. That's amazing. And then
That was part one, though? You said, was it this a two-part?
Part 2 was just taking sciences and going shadowing at the hospitals and whatnot, and just seeing how these guys work in med school, 90-hour weeks, and I was just like, dude, that's not for me. So
so you were you went and checked out med school, and you
no.
I mean
I was playing football at the time too, so I didn't really have the grades for med school. But and then so my roommate in university, his dad was the clinical dean at the UBC Dental School.
UBC in Vancouver?
Yeah, Vancouver,
Oh, yeah.
and he's actually from Cape Breton. So he got hired to start a dental school in Chicago, which is Midwestern Dental School, which is the sister school to the one in Arizona already existed. So that was kind of my little in there.
Nice.
So that's how that happened. And
Love a
then
good in.
You need it. If you want to just have
Take what comes.
a 3.5 instead of a 3.9, and then try to get into dental school, a little in.
Yeah.
Little in.
Fuck yeah.
All right. Because it
Thank
really
you
all
to
doesn't.
those
It doesn't all
ins.
matter in the.
If you're inning, we like you.
It's who you know.
It's who you know.
Yeah.
It's who you know,
A lot
and
of
it
times.
really helps. Just be nice, smile, and be a good guy. And
That's true.
You are a good guy.
Yeah.
Fuck,
yeah.
we must have known each other for what?
Yeah.
6 years?
Well, yeah, like
Going to the yoga studio?
Yeah.
6 years for sure.
Yeah.
Absolutely.
sick.
Yeah.
good
yeah.
stuff.
Yeah. Absolutely.
And so when did you find yoga? Like, how did that become a part of your life?
Yeah, it was a couple years into working. Like, I think actually, I was thinking in January I was gonna try, because it was January. It'd be 10 years ago that I did a first Bikram class. So I was gonna try to like do
Nice.
something crazy that month, go to like as many classes as I can, just to be like, hey, this is my 10th year doing it.
Yeah.
Because I'm on and off. Like sometimes like I'll
Me
be
too.
psycho about it, and then like
Yeah.
other times I'll be like, fuck, I need to go back. I haven't been there in 3 months.
Yeah.
And, but like it's definitely like it's such a good like mainstay to
I
just like
agree.
everything. Like it's just
It
because you know
is.
where you're at, like with your body when you like just like it's
Totally.
like a zero. You
Yeah.
always just check yourself, and I like love it for that. So yeah, it's great.
It's a special feeling after
Yeah.
a hot yoga class.
I know, especially when you have a great teacher.
Yeah.
Yeah.
I just became one just recently. I'm almost 12 years teaching, and I'm like, okay, I think I'm a teacher.
Wow.
Yeah.
Wow.
Yeah, no,
Yeah, I
Whitney
feel
teaches
comfortable.
an amazing class.
Yeah, she does.
There was one more thing. There was a filling. I think you want the amalgam.
Yeah, I guess that's the only other thing. Amalgam fillings, get them out of your teeth.
What is that?
The metal?
Yeah, they were called silver fillings, but really they're mercury fillings.
Mercury.
They're 50% mercury. Yeah.
What the?
Why
fuck?
was that used?
Well, it was just used because it worked.
They didn't know about the side effects?
It lasts a long time. Like to do a white filling, it's like very technical. There's many steps. You need like two people. Like a good assistant. You need good isolation. You need all these things to go right. If you do like one of the steps wrong, then you're not going to have as good of a white filling. A mercury filling, you just drill the tooth out and you pack it in there and then shape it and
It's a mold.
Yeah, like you can do it if there's
That
like
makes
if there's
sense.
saliva everywhere, and like it's cheap, and so but they are like for a fact 100%. Like there was a German study that showed that like the amount of mercury found in like a fetus's brain, a fetus that was lost, was directly proportional to how many mercury fillings were in the mother's mouth. So like it's transferred through the placenta. So future mothers, like if you're gonna have a kid, just easy, get your fillings taken out. Preferably try to get them taken out with a rubber dam on so that they're isolated. Because like the second that we start drilling on that filling, the mercury vapor comes out. It's coming up anyway, and then it can cross the blood-brain barrier and turn into inorganic mercury in the brain, and just lead to all these that's like Mad Hatter's disease back in the day, right? That was like they were making the hats and it had like mercury on them, and they were just like sniffing mercury all day.
What?
Yeah. So mercury's
And then they went crazy.
yeah.
The
it's
Mad
a-
Hatter is actually like a idea. I never thought about that.
Yeah.
Somebody who makes hats becoming mad. It's because of mercury.
Yeah.
Holy
That's
shit!
it, that's it, yeah.
What contributed to the Alice in Wonderland story? So that was cool.
Yeah. Hey.
Oh, that's sick. We're all mad here.
That's
Yeah.
good. We did Alice in Wonderland together. I was Alice, and
yeah?
this guy
That's the
was the
rabbit.
rabbit.
The rabbit.
It was such a fun play. Oh my god.
Wow.
I was obsessed with that movie for a really long time. And this was before I was doing psychedelics, but now that I've done acid, I'm like, oh, I want to do acid and watch Alice in Wonderland
Yeah.
again, see what that's like.
No, that'd probably be a blast.
I think so. Yeah.
Yeah.
That's so
absolutely.
sick.
Absolutely.
Yeah, dude.
Bro,
Fuck.
you
What
have
did-
blessed us.
Yeah, I was just gonna ask real quick. What
Yeah.
position did you play in football?
Receiver. Yeah.
Quarterback.
Yeah. Nice, man.
We got.
You look like a QB.
I know.
Yeah,
get
right?
the shit kicked out of
Sometime,
me
man.
and get up. Yeah,
Yeah,
I'm down.
yeah,
Oh my god,
yeah.
I love throwing.
Yeah?
Yeah.
Absolutely, man.
Fuck yeah.
That's
No,
cute. He doesn't
quarterback's like,
normally do sports.
You can get fucking your ass kicked and get up.
Yeah, that's it.
The
So you're
smallest
the
one
one
on
who
the
crossed
team.
the goal line.
Yep.
His
Not
this.
enough times, unfortunately, but we didn't have a great QB, so that was the issue.
Yeah.
Sorry, Keith.
Shotgun pattern, man. Take the 10
We
yards.
love you still,
and run
Keith.
it. Yeah. Fuck. Hail Mary toss sometimes. If you fucking landed one of those, you just feel
yeah.
like incredible.
Right.
Fucking throw a
And so
40
you
yarder.
do a lot of continuing of your learning. You do a lot of
Yeah, you care. You're
extra
obsessed.
studies. Yeah,
Yeah.
you really
You're
you really
passionate.
seem to. Yeah, that's what I got from your bio when I was reading it. I was getting excited about your bio this morning because it just felt like
You care.
I don't know. I guess if I'm being totally honest, like I don't normally associate dentists with people who like love their job.
Right. Yeah.
You know?
Well, that's the thing is that like, you know, you go through these waves and you find out that, hey, listen, like, why am I like really not enjoying my job right now? And it's because you're just falling into that routine of just like, you know, like you're just doing the work and you're not like trying to, you know, get better at what you're doing.
Yeah.
And like, you know, like sometimes like there's not like a great patient on the other end of it.
Yeah.
And like, you know, you just like have a crappy day and like, you know, so, you know, whatever it is, like there's always something like to learn more about. And like, you know, it's just about kind of like, hey, finding like, you know, what, you know, like your little sub passions are. And,
Yeah.
you know, like there's like always like a little challenge there, like something that you want to like, you know, because it doesn't always work like that forever. Like you'll get to a point, I've seen dentists in their career, you know, where you just like, you know, like, you know, you start to, you know, wind down, go backwards, just because like, you know, it's a lot to be doing, like
Been doing it for
all these things, you
Yeah.
know, but like for now, for me, I'm 10 years in, so like, you know, it's just like, you know, it's exciting to learn, do like, you know, find out like, you know, hey, like how far can I push myself, you know, and the things that I can do, and so yeah, that's like, you know, that kind of keeps me away from like the burnout part
Yeah.
of the job, because it's definitely right there if you're not like doing it, you know. So yeah.
Do you ever have any funny, hilarious patients that come in, or just like
You were one of them.
I was a
Yeah, you were.
weirdo for sure.
I did have the one that comes to mind. I had like a little, like maybe she was 18. I was taking out like 2 wisdom teeth, and so you know, like I usually like for like, you know, like you can go to the oral surgeon and get the full on sedation, but like, you know, if it's a, you know, fairly like easy kind of like, you know, like
I was awake for my wisdom.
Yeah, right. So like we do it awake, you know, and like, but like I'll give, you know, like, you know, we give nitrous, like the gas for sure, you know, if that's
Yeah.
the case. So, you know, like I had this girl, and like as soon as I got the gas going, like she was kind of delayed in like feeling it, so I was like kind of turning it up a little bit more, and like as soon as I got it up, she was just like, do you listen to Taylor Swift? And then I was like, you know, like I hear her on CHFI here, you know, in the background, like often, but she's like, you gotta go see her in concert.
She was a Swiftie.
Oh yeah, like full on Swiftie, and just like the
dropped
second the
the
gas was
guard.
up, she was just like pitching the Swift, and I was like, you know, like she was pitching it well. I was thinking like, you know, I was like, you know, I would maybe go with you. Yeah.
I would want to see
They're-
what you see.
They are unbelievable fans.
The
I
Swifties
can't.
are
Yeah,
hardcore.
they're
They tried to
amazing.
recruit us. It's incredible.
listen to Taylor
Do you
Swift.
listen to Taylor
Yeah.
Swift? That's incredible.
Yeah.
Do you ever get nervous before doing surgery?
Yeah, 100%. Like, you know, like I'll often do stuff for the first time, and you know the patient doesn't know that, but
Yeah.
but I do.
That's
And, like,
good. I think that's good.
No, it's like adrenaline, and it's like this crazy feeling, and then like, you know, when you're done, and you're like, okay,
Yeah.
now I can do that now. Like, you know,
Yeah.
I thought I could, but I didn't know.
For sure.
You know?
Yeah.
And you're kinda,
There's
you
always
know?
that little bit of I didn't
Yeah.
know.
Every time I step up with a client or show or something like that, or the size gets bigger or whatever, the
Yeah.
next step is always like that new challenge. It's like, you're right, you walk into it like, yeah, no, it's really like I've told myself I can do
Right,
this,
exactly,
but like
yeah.
now I'm gonna do it.
Is there a lot of
Walk
prep
through.
involved when you're doing something for the first time?
Yeah, 100%.
Yeah.
Like, you know, make
Lots
sure that
of
you don't
study.
fuck up.
Yeah,
you
for
know,
sure.
Tons of YouTube videos.
Probably just
tons of,
over
like,
prep.
yeah,
You're
it's
just like
yeah.
ready to kill it.
Because
You're
you just
ready
gotta be
to
ready
do
for
it.
the complication, right?
Yeah,
And then,
yeah.
like, so as long as you don't get the complication, then you're good. You know?
Nice.
Like if it's not like a perfect result, then that's what you get better at as time goes on. But you just don't want to have the fuck up. Right?
Yeah,
So,
no.
Yeah. So yeah, that's where like the
Nice.
Yeah.
Yeah, that's cool. That's
Yeah.
nice of you to admit. Thank you.
All right,
You guys asked some great questions.
Thanks, bro. No, I
This
appreciate
was,
you
like I
answered
said,
the
first
great
time
one.
doing something like this, and like
You're
what
great.
what a first time. You
Yeah,
guys are
thank
amazing. Yeah.
Thank you for blessing us.
Yeah, seriously, there's going to be so much that is so shareable. And this has been in my vortex like for a couple months. I had like,
Yeah,
I
we
think
really
back
wanted
in
this.
June, I was like, Jordan, question mark? So thank you for
fuck
taking the time.
Awesome.
And blessing the people and us. We're going to definitely take some of your tips. I'm excited actually to like level up my oral care
Yeah.
after
Thank
this
you.
conversation. So thank
I
you.
do, yeah. I so appreciate you. I feel like the funny elephant in the room is like, aren't dentists like the number one like depressed people or something? Isn't there a stat
I think
like
it's like
that?
4 now, actually. Yeah, I think the bankers like overtook us. You know, 'cause
Yeah,
they got
that makes a lot of sense.
Yeah,
There's a lot of guilt there where you
Yeah.
guys are, but I just wanted to ask I mean, first of all, you're a great example of someone that's like leading with the heart, obviously in a wonderful space, in a mindful space, and passionate about the craft. So you're definitely not that.
Yeah.
But like, do you have colleagues that you observe that from? Have you seen that? Is that funny stereotype just a joke? But it was a stat you said, right?
Yeah,
Or-
it's a stat. I guess it's a stat. I don't know where the stats always come from.
Yeah,
I haven't seen too much of it. You know, like a lot of like the people I work with and that, you know, my friends that are dentists too, like they, you know, for most of the part, like love doing their job. You know?
Yeah.
So yeah. So
That's
you know.
great.
That's sick.
Yeah,
That's what I
yeah.
feel. That was so good just to like, be able to hear how and like why you're so inspired. That's so beautiful, bro.
Yeah. Thanks, man.
Thank
It would be just a shame if I didn't take this opportunity to ask you if dentists can tell when people suck a lot of dick.
Ooh.
She has a joke like this.
It's in my stand-up routine
Okay.
because
Okay.
a woman shouted that out at one of my shows
Yeah.
that dentists can tell if you suck a lot of dick because the back of your throat bruises. And I've never fact-checked it, and I tell the audience that, and I go on to make a joke that says, like, because whenever I go see my dentist, he asks me, how's my husband? And there's this whole joke around it.
That's an awesome joke.
Thank you so much.
That's
It's one of my
amazing.
best
Yeah,
jokes,
that's amazing.
actually.
Yeah.
And
So
then-
whoever's watching, like, don't fucking say shit. It's not online.
Yeah.
Maybe it is online, actually. I can't remember. Anyways.
It's a funny, consistent banger of a joke.
Yeah,
Yeah.
people love it.
But
It's
it
one of my
sounds
best
like it
book
may
jokes,
not be
but
true.
Yeah, if
No,
you
I'm not. Actually, I'm not going to answer the question. So I'm not touching that perfect joke. That's amazing. So that's it.
Thank you. I love that. Is there anywhere you want people to find you, or do you want to promote anything?
Yeah, I mean, I just started working downtown. I'm working at Ansarian Dental Clinic, so could always use some new patients there. If you want to come hang out and meet me, we can do that.
Awesome.
I'm just there a couple days a month right now, but I'm going to be ramping it up when golf season ends.
Nice.
So, yeah.
Do they have, just for Rob, do they have the government program implemented?
Everyone
Yeah,
does.
everyone's,
Oh, everyone
everyone's
is.
pretty much
And
doing it.
they'll be
now.
Everyone's pretty
Yeah,
much doing it.
everyone's
Nice,
pretty much
nice,
doing
nice,
it now.
nice.
So yeah.
That's
Literal
sick.
statement
Yeah.
of his work.
Yeah.
And he let me keep
Oh,
my
yeah.
mutant tooth.
Yeah, his mutant tooth.
Oh yeah.
I love that tooth.
Yeah.
Do you see teeth like that? Is that very
Yeah,
rare?
I see it. Yeah,
You
yeah.
see it?
Yeah, you see it.
Oh God,
Yeah,
I've
yeah.
been obsessed with that tooth since the day I
it's
saw
pretty
it.
cool.
Yeah.
It's tucked in there.
It's just, I had
It's a bonus tooth. You ever need you lose one, bring that one up.
You got that special toe.
Yeah.
You became that special magic dude
Yeah.
who can just pull it.
Pull it up.
Who can change
Yeah.
the wizard, the alchemy, the tooth alchemizer.
That's it.
Bless you, man. Thank you so much. for
Thank
doing
you
this.
so much. That
Blessed.
was so
Very
great.
welcome. Very welcome.
Go check out our man, Jordan.
Take care of your teeth.
Subscribe, tell a friend. Yeah, that's right. Do
Take
that
care of your
thing.
mouth.
Pull.
Yeah.
Bye, I love you.
Bye.
Sweet.
Oh my God.
Welcome to
dude.
Disciplined Stoners, the gateway drug to mindfulness. Look deeper.
To think that we started this podcast to fight a stigma, only to uncover so much love that we realized that you can't put your energy anywhere but what you want.
Look deeper.
And what we want is authentic conversation. What we want is quality medicine. What we enjoy is each other.
We get to learn from our guests. Manage the best. I would manifest this.
Part of the magic of the plant is how it uncovers what you've been hiding away.
So much love.
Look deeper. Feel more. Tune in.
So much love. Look deeper.
We're not here to be lazy.
Welcome to Disciplined Stoners,
We're not here to distract ourselves.
the gateway drug to mindfulness.
We're here to learn. We're here to grow.
Put anyone under pressure? I gotta give these guys right of refusal. They paid the big bucks, but if you're ready, you're ready. You ready? Okay, come have fun. Put your hands together for this lovely lady in the white hat. What is your name?
Enki.
Enki?
Enki Enki, like ink, but with a Y, Enki.
Okay, beautiful. And do you believe in love?
I mean, if it's good, yeah, why not?
Enki needs that good loving. FYI. What's the most romantic thing someone has ever done for you?
Oh, it involves frozen strawberries, and I can't talk about it in public.
It involved frozen strawberries? I got enough. Go back, sit down. Thank you so much. Hands together for Enki. That's cold fruit and orifices for sure. I don't know which ones. Frozen raspberries got 8. I don't know from which ends. Any musical styling for inspiration from the gentleman or you guys? Specifically, you or you? Give me a genre of music that you enjoy. Jazz. Fucking awesome. Let's get jazzy, and we're playing with, this is called Frozen Fruit. It's getting hot this year. It's getting hot in here. I need to cool down. I need to cool down. It's getting hot in here. What shall we do this year? Let's try something different together. Man, the fridge is empty, but I should check the freezer. Yeah, we should touch each other. Yeah, kiss and tease ya. Where you gonna put this? I've taken off my Caesar plus my t-shirt, sitting in the bleachers. What you got? I got a sweet little slushy. I'm spinning it round. Tastes like cherries now. It always tastes like delicious fruit when I'm going down. That's what you were hearing about. The last person, Winnie, I eat it out. Sorry, that's my dad, but this is the evening out. We just gotta get cold inside. We just gotta feel so this time. We should try something different. We got that cold fruit. Yeah, I know you know what we go through. Yeah, I console you. I just want to put this fruit where you don't usually do it. That's okay, but the fluid running down like my veins. You can see either way. Raspberry on your face, strawberry, very messy either way. Yeah, it's scary. You can see it every single day. I reimagine that moment. I took those raspberries, I put them where the sun don't shine. No. I need a snack. Yeah, an evening out. We can lead it back to my home. It's like I be eating that. You can see it gets sweeter. Sorry, that's the sweetest patch. Patch your love, soul patch. Catch me up, hold that. Yeah, man, that's cold. Damn. Get that out of my ass, we moving too fast. You bastards now get back to the romance. I need some cold fruit just to console you. You know what we came to do. Watch this. Baby, you should see me tap dance. Baby, you should see me tap dance. And I dive in and I eat it fast. Tap dance. I dive in and then I eat it fast. Damn it, man. I would love to hear a drum solo. Let me hear you make some noise if you would like to hear that also. I think Phil can hold it down with a simplistic kick while he kicks this. Go ahead and show him what percussion looks like. Raspberries, blueberries, pineapple, but they're all frozen. I'm still curious about that. Raspberries, blueberries, pineapple. Let's bring it down. I love to be adventurous, but I'd be pretending if I would say I had the propensity to try the shit, but that might be more exciting if you stand beside it and have a little more commitment. I'm just saying you dipped, but I told you to leave. You were like, do not pry at me. You could not find me. Give back my ID. Yeah, yo, I paid the ticket at the door. What are you fucking with me for? Seriously though, I want to know more. Just remember that fruits are good for more shit than just eating directly from the bag and in your hand and in your mouth. You can put them somewhere else and go eat it out. You see what I'm talking about? Is this awkward? Is this your daughter? Fuck, this is awesome. You're learning what they get up to, how you came through. You bust through after he kung fu'd her. Yes, sorry. But you were a young dude, and I'd love to make this awkward for all three of you, and I'd love to. Aren't you glad that you came too? She's like, fuck, man, this is a strange dude, but I love that, but I'm banging out. Yeah, fruit now, and I ate you. Take two. Well, we got that raspberry. We got that frozen fruit. Doing what we not supposed to do. We got that raspberry. You know that we're not supposed to do. That was kinky. This is lit. I'll keep going. Should I keep going? Okay, cool.
I made this for you today. This is the best cucumber tomato sandwich that you will ever see made or enjoyed by anyone ever in your life. You can watch this episode and learn how to do it yourself. I'll tell you firsthand right now how delicious it is. You hungry? Let me make you a cucumber, tomato, and basil sandwich on fresh sourdough bread. Yo, today we scored this really fresh, nice sourdough bread. Check this out, slice it right down the center, easy breezy. Nice wide slice for you. Oh, come on. Go to a bakery, a local bakery. I paid $3 for this loaf, this whole loaf. And these 2 slices are gonna be my big sandwich. But you can't just expect wet vegetables to sit on that and not soak through. So, olive oil, hot pan, pepper, salt, rosemary, sizzle, sizzle. So good. Sear your bread. You let that rosemary infuse the olive oil, stick to the bread, let that do its thing. Now let's get back there. And chop these tomatoes and cucumbers. But always just enjoy yourself.
You guys, let me have a bite.
I know when wants to do it too. We're partying today. Very simple base, tomatoes. Hello, look at this. Beautiful, simple. Nice and meaty. I like the element of the tomato because it can keep it thick and meaty. Pause. Beautiful. The skin sweet, the flesh aromatic. The rosemary is really cooked into that oil. Put a little paprika on it too, on the side. Cucumber time. Thin, easy, enough to cover the whole thing twice or 4 times. Whatever you like. Keep them even, keep them thin, keep it fun, keep it light. I'm having fun all night. Now, you may notice that we have pepper on the tomato. And what are we gonna put on the cucumber then? You wanna add flavor to your sandwich. The other side is done. Sun-dried tomatoes. And basil. Let's chop up these sun-dried tomatoes just to sprinkle on top. Adds this kind of Mediterranean antipasta vibe just to have throughout, you know? And instead of lettuce, we do basil with this sandwich. And instead of any Havarti heavy cheeses, we did a goat cheese, which I thought would be really nice. So we have our main ingredients done. I got some fresh basil here. Make a pile of this food before we make a sandwich of it. I like to give the basil the chance to kind of like delight and surprise you throughout the sandwich. It may not be layered the whole way through like lettuce usually is, but when it goes in there, it's really a delight when you get a bite of it. So, we'll bring our other buddy over here. I'm a fan of just simple mayo and mustard. The King Stoner sandwich. Let's dress it up easy, nice. But remember, we did sear the bread, so it not only has that wonderful layer flavor, but it also has some backbone to stand up against sauces. I'm gonna go ahead and make it like a cohesive with the goat cheese and let it introduce itself to that sauce. Meet your new buddies. Maybe toss a little fresh rosemary in there. Hello. Simple and easy, friends. Actually, let me do the other side of goat cheese, because we will put some goat cheese in the middle as well. And we do want to have an abundance of our ingredients throughout the sandwich in every which way to really let the personality speak. Yeah, goat cheese is not often thought of for sandwiches, but it's a spreadable. It's like an OG spreadable. Let's assemble. Tomatoes. Layer like a sexy Greek goddess. Treat her with respect. Join its friends. They could have been from the same patch. You ever think about that? The same patch? Is that where they grow tomatoes? Patches? The only thing missing from a caprese is the bocconcini here with this vibe. Because you're getting the basil, you're getting the tomato, you're getting the salt and pepper, you're getting the olive oil. Crank out some of these cucumbers here, these salted cucumbers. Try to sneak some in there, double layer. I got double layered cubes on the sandwich and you know about it. So Astounded, go stream it now.
I got double decker flows on the road, what you know about it? Couple levels up when I move and I go around them. Only focus on where I'm going, I don't beat around it. You know who you talking to, you can see by who's around them. Double decker flows on the road, what you know about it?
What more do you want from me? Get the fuck out of my face, look at this. I did promise more cheese. If you're asking me, a guy like me, that looks like a beautiful sandwich right now. I'm gonna fold her over. Okay, I'm gonna bless this now with some olive oil. Something I do on every sandwich. The olive oil is blessed. Let's eat this sandwich that we just made. Cucumber, tomato, basil, sun-dried tomato, goat cheese, salt and pepper, olive oil, mustard and mayo. Hope you enjoyed yourself. I know we started with saying, are you hungry? You hungry? And I was gonna make this for you, but we're over the internet. So I'm gonna eat it. I'll tell you how it goes. And you let me know what else you wanna see me cook. This is just a classic, awesome, it's a stoner snack. It's also just like a healthy person snack. Get the sourdough bread. Go to the bakery. Get the $3 whole loaf. This whole thing, $3 at a real bakery. And you're not victim to having to buy meat. Meat is like $1,000 now. This is a beautiful, unctuous, fulfilling, healthy snack and sandwich. Searing the bread is a big thing here. It's like you ordered it at the Ritz-Carlton. It's like if you ordered a sandwich from the Ritz-Carlton. It's like Ritz-Carlton tomato and cucumber sandwich. You hungry? You want Ritz-Carlton cucumber tomato sandwich? I made this for you today. I tried to make this today. Can you please subscribe to this channel? This is a podcast, Disciplined Stoners. New episode every Friday at 7 p.m. EST. I want more of this right now. I can't talk anymore. Love you, bye.
Okay, so now we have this